Great, thank you.
Thank you.
And so I think those were our three department updates. So we'll move on to item number 8, which is the COVID staff update.
Good morning, everyone. Marilyn is out of town today, so this is Megan McCammon, Assistant Director of HHS. I'll be pinch hitting for her while she's out. And I think we've got Dr. Richardson, Leslie, and Anna here, so we should be good to go. I just want to start off today quickly by saying we had a very successful mass vaccination event, our first one at the fairgrounds in Bishop over the weekend. We got 1,013 doses into arms over a 2-day period. And I want to start by just thanking from the bottom of my heart the people in HHS and in the public health team, as well as the rest of the county staff, Northern Inyo Hospital, who partnered so closely with us to get this up and off the ground quickly, had their staff there, paid their staff to be there, helped us staff it to a huge extent, as well as volunteers from Dwayne's Pharmacy and volunteers from Toyabe and volunteers from all over the community who helped us put this together. And this is it was an especially huge lift because if you want a little backstory on it, we didn't find out that we were getting this until Anna got a call on Sunday night saying, hey, we've got 1,000 doses of Pfizer for you. It's coming this week. You've got 1 week to get them out. Good luck. Click. And it was a holiday weekend. People were out on Monday. So really over 4 days, the staff and our partners from around the community stood this thing up, got people registered, got people in, and got more than 1,000 doses into arms. So it was a huge lift. I think we're all just kind of befuddled and exhausted at this point, but it was very successful. We're very happy that we were able to do that. And hopefully that's the first of several mass vax clinics that we're able to hold until everyone in Inyo County has a vaccine. I do want to make a quick note that the vaccine clinic was really targeted to people over 65. That's our big push right now because we had so many in that tier. Other people who are eligible right now were able to get into the clinic and did get vaccinated. So that while the vast majority were Inyo County residents over the age of 65, we did have a good smattering of others in the 1B1 tier. That's educators and childcare workers, emergency services workers, food and ag workers, including restaurants and grocery stores, and of course, 1A1 healthcare workers as well. So all of those groups of folks got in. And any remaining vials that we had defrosted in preparation for the clinic. I want to note, not a single dose was drawn up that didn't get into an arm. So we filled every single dose got into an arm over the weekend. We had some vials defrosted that are going to roll over into Northern Inyo Healthcare District's clinics for this week. So not a single dose is not going to make it into an arm over this week. One other quick vaccine note. Last week, our Moderna allotment got stuck in the Midwest snowstorms. So Vaughn's Pharmacy, Valley Health Team, Northern Inyo and Southern Inyo, we're all expecting to get some Moderna on top of that 1,000 doses of Pfizer. Those have been sitting at the Moderna factory waiting until it's safe to ship out. We did get word that those allocations from last week and this week's allocations are going to start to ship over the next couple of days. So we are expecting to see an additional 900 first doses coming in over the next couple of days. And everyone who had appointments for last week at Bonds or last week at Valley Health Team, those appointments should be rolling over to this week. If there's any issues with that, just email vaccine info and we'll figure out what went wrong. So vaccineinfo@inyocounty.us is a fallback to make sure that you get in, but people who had to reschedule from last week should be in for this week as those vaccines start rolling out again. And I'll turn it over to Anna. A quick note on our tiering. It looks like we're going to be in the purple tier again today or this week, projecting that. But it does look like our case rate and positivity rate, they have improved significantly from early January. To get down out of the purple tier and into the red tier, we have to be below an 8% test positivity rate. I think we're at 11 right now, not too far off. And then we have to be below 7 people per day as a case rate. And we've been averaging, Anna ballparked it this morning, at about 10 per day. So again, moving closer, but moving closer very slowly. And with that, I'll kick it over to Anna.
Thank you. And I do want to, well, one, reiterate what Megan said around just recognizing the huge outpouring of support that we had from our traditional partners in the community, in the healthcare community, as well as other volunteers within the community to get the mass vaccination clinic up and running. It was just went so much smoother than I honestly was expecting. It just went really, really great. It was wonderful to see so many community members get vaccinated. So we're just really pleased with how that went and look forward to continuing to improve the process so we can continue to offer those clinics up in the community. Also want to jump into our case rate. We won't know for sure our designation until about noon today, but we are tracking our numbers, and it does, as Megan said, appear that we'll continue to be in the purple tier. We had been tracking right along with the rest of the overall state of California on a downward trend for our overall case rate. From mid-January into mid-February, we were on a downward trend. We have seen a little bit of a bump over the last couple of weeks where we had been seeing more like 6 cases a day. We're now seeing more consistently an average of 10. So not a hugely concerning increase, but it is enough to keep us leveled out barely in the purple tier, unfortunately, which means that we haven't just over these last couple of weeks continued that downward march toward red tier, orange tier, yellow tier that we're hoping to continue to see, especially as we get more vaccine out in the community and hopefully start to address the transmission rates that we're seeing. And also, as Dr. Richardson has said in the past, preempting the possibility that we see surges again with some of the variants that are more transmissible. So we're monitoring those cases, certainly continuing to do contact tracing and follow up and isolating and quarantine individuals who are either positive or have had close contact, keeping that as the forefront and one of our core activities out of public health. But unfortunately, seeing a little bit of a trend in recent days and weeks to upwards. So wanted to share that is something that we're seeing within our communities. And again, expecting to see that purple will be our tier assignment again for this week. I'll pause and see if Dr. Richardson has anything to add to.
Good morning, board. I would like to say and expand just on what Megan and Anna had said. I was so impressed with the vaccination clinic. I was really astounded how much effort and planning went into this. And I can't give enough thanks for Anna, Megan, all the team, Bree. There's so many of them that were involved that it really could not have taken place without their expertise, planning, and implementation. I was so actually, there's no words to describe how well it went off. There's not much I don't think we could improve on from the clinic. So moving forward, that model is going to be our model with maybe some fine tuning, but it went so well. When I went home on Sunday evening, I was so pleased that I get to work with these people. It's just amazing what they did. So I would like to thank them, and we all should thank them for what they did. And moving forward, we're going to have similar clinics, hopefully, and it's just going to be great when we get the numbers up in terms of vaccinations. That's all I have to say for today. And
Okay, thanks. What I think we'll do is, I do have one question from the public, and then we'll open it up to questions from the board before we move on to Leslie. Okay, so if we could promote Ms. Chaplin.
Hello, I'm still around. It's been a year since I participated in a meeting, but I wanted to say hi. And I wanted to say that I participated in the weekend vaccination clinic, and I think it really went very well. So I want to extend my congratulations to everybody who worked so hard to put it on at short notice. Keep on doing what you were doing. You did great. So thank you.
All right, thanks for the kind words, and nice to see you, Linda. One of these days we'll be back in the boardroom and we can see you in person.
Okay.
Okay, which supervisor wants to start? I see Dan has a hand raised.
I'll start off. On Sunday morning, when I got a couple calls saying that there were spaces still available, I made calls to about 20 people who met the qualifications of age and location to see if they could take up some of the vaccines that might have not gone unused on Sunday. And 4 of the people of the 20-ish or so, 4 of them had already been to the clinic the day before. And 3 of them, who I've never heard say a positive word about anything, were just gushing about how well it went. Well done.
Okay, great. Other supervisors?
Sure. I'd just like to thank the public. I think, we've heard a lot of horror stories about these max vaccination clinics in some of the urban areas where people were pushing in, people were in line for 3.5 hours and then mad because they didn't get a shot. I didn't see any of that. I happened to go there. I was there. And it was just the opposite. And that's one of the advantages we have of living in a small town, where somebody standing in line says, "What's the time of your vaccination?" And they'd give them a time, and they'd say, "Oh, well, I'm later than that. So you just come on up here and get, move forward." It was just amazing. So I think not only the staff, excuse me, and the people that were working there, which were tremendous, but also the public that attended. They were just very grateful, very respectful, and it made it go a lot easier, I know, for the staff. So thank you very much.
Great. Matt, did you have something?
Sure. Just a couple of comments. One, I looked at the counties that had moved out of the purple. It looks like now there's 6. I think last week there was 5. So it's not happening very fast statewide that anyone is getting out of that purple tier. I have to say, the restaurants in Lone Pine are desperate to get in-seat dining going again. And I know there's nothing we can do right now, but I just hope that, Jeff keeps getting hints that maybe something's going to happen. I hope that they stop hinting and actually do something to help that situation. I got my vaccine on Saturday, and like everyone was really impressed with the organization, and you know, I had no idea how you were. I was expecting to get, you know, I'd see big 5 lines or something that I'd go get in line and then get through. There was no lines. There was, things just moved through really smoothly. Dr. Richardson, were you there on Saturday?
Yes, I was. Yes.
Did I speak with you?
I don't recall. There were so many people there. It was sort of a blur in my mind what took place.
Okay, so I felt like I was in kind of this daze, not having been around people. Everybody was in a mask. I'm afraid I talked to people that I was trying to look at name tags to figure out who I was talking to. So if I did talk to anybody, staff, and that they seemed like I didn't know them, it was just, I think we're going to go through post-COVID something, you know, where we don't just haven't been around people. And I felt kind of bad when I got home, and I thought, I wonder if, I hoped I didn't offend anyone. I was thanking everyone, but anyway, so
I'm sure you didn't.
Okay, well, it was, I'm wondering if there's going to be some adjustment needed to being, you know, in big groups with people that you haven't seen for a couple of years, and me not being really great at remembering names and then only seeing half faces. So anyways, and I'll just reiterate that, I mean, I had people calling me saying, oh my gosh, I can't believe how easy it was to get the vaccine. And I will say that the one hiccup that I got a little bit of pushback on, not a bunch, but it was the issue with the zip code. Because when I started calling people on Saturday, I did run into some people who said, oh, well, we tried to register, but it wouldn't let us because we had the wrong zip code. And they lived in Atlanta, and so they don't necessarily see the paper, hear the radio, and luckily they got on and were able to come in Sunday and get the vaccine. But that was, I thought, a potentially difficult situation. You guys did a great job on handling it, but also I think everyone has to understand how quickly we stood that up and how quickly you had to, you know, that was one glitch that no predicting. And so thanks. I think you did a great job on that, as much as we could. So I'll leave it at that. It was, oh, look, there's Marilyn. But,
yeah, I'll just jump in real quick. That was the product of my turn, I believe, the zip code thing, wasn't it?
yeah.
That wasn't our fault. You know, I guess I'll just jump on the heap here. I think that there's been so much tension and disagreement, and we've certainly battled it out ourselves. Where credit was due. There's often a lot of times comparisons to other counties, particularly here in the Eastern Sierra. And I happen to have family who attended a mass vax clinic in another county. And I got my family member who was in a vulnerable population into this clinic, and there was no comparison. So kudos to you guys, really rocked it. Good job.
Great. And I'll repeat what everyone else said. I am very impressed with how smoothly things went, and I'm super appreciative for all of the hard work from our staff and from our partners and the volunteers. It's really amazing. I do have a few questions. So will the second doses for this clinic be held in a mass vaccination clinic as well? And so you'll basically stand the same thing up three weeks from now?
Yes.
Okay, good. So the zip code thing was a challenge for some folks. You know, I think we were able to deal with that as best we could. I know that I ended up helping quite a few people who had difficulty navigating the My Turn, or, you know, that zip code thing was a challenge. So I think there's some current confusion of when people sign up now for My Turn, if they enter in the zip code they live in or 93514. So moving forward, my understanding, what I've been telling people, is that was just for this clinic and that people should put in their actual zip code. Is that correct?
It's difficult because if we were to expand the zip code, we'd be pulling in people from Fresno and Tulare. I would hope that My Turn, the state, works through some of their circumference issues as they're building out, but I don't know if there's a timeline for getting that fixed up. My thought would be, if you sign up, Anna, correct me if I'm wrong, if you sign up using your real zip code and then you hear on the radio that we're holding another mass vax clinic in Bishop or Lone Pine, you could then go in again and put in the new zip code from Bishop or Lone Pine. And now that we know that this is an issue, we can advertise that. And then you could scoop into a clinic on a as you come basis. When you put your zip code in right now in My Turn, you just kind of sit and wait. And let's say you live in Olancha, you might get scooped into one that's available in Ridgecrest, and that wouldn't be a bad thing either. So putting in your real zip code will open up for you to get into a clinic that is held near you, maybe by another county.
Okay, thanks for that. I think that goes into my next question is that's still confusing. And, I think at least some of the people that I was helping, even without the zip code issue, just sort of the persistence of some people to be able to get through the My Turn website is challenging. And the folks that I helped were either people who saw it on Facebook, but more often someone who saw it on Facebook and then talked to one of their more senior friends and neighbors, then needed some assistance. So I know we were making calls to folks. Can you describe the assistance we're giving to seniors, and are there ways that we need to improve that, or maybe engage some volunteer groups to be able to help that outreach?
Well, I'll jump in. And I apologize, I'm in and out for today's meeting, so I just happen to be able to join. Marilyn Mann, Health and Human Services, and thank you, Megan and Anna, for covering for me this morning. Yeah, we pulled, I think we had 252 people that were registered on our county site that did not have a email or address on file. And so we just split them up and between 10 or 11 of our team members, and we called each of them. Some of them received assistance right then and there, helping to register. Some were given the phone number. And My Turn does have some glitches, and they've been fairly responsive and are listening to the feedback. I know that on Thursday, when I helped one gentleman register for an appointment, he, we found out that if you didn't have an email or text, there was no way to get the confirming code back to the scheduler. So I gave some feedback in the moment on Thursday, and by Sunday they had corrected it. So I think hopefully as we continue to document some of the challenges with My Turn, our hope is that they will incorporate some fixes to the system. But in the meantime, we are continuing to help those who may not have that technical expertise to navigate those systems. So, and I just, there are moments in your career where you you know, you can get choked up by how fortunate you are to work with the people you work with. This was one of those moments. This team is an incredible team, and I'm so thankful for them.
Well put. Well put. We are lucky to be with the group that we're with.
I had a question.
I've got a few more, Dan.
Go ahead.
So on the positivity rate metric, you'd said that I think last week we were at 7.5 or something like that, and we're at 11 now. That seems, it seems to be kind of a challenging metric to be using anymore, given that as you know, people who got vaccinated, they're not going to get, it's going to be hard to get enough negative tests to get that lower, because fewer people are getting tests because they're tired of it anyways. But also, you know, we have fewer people who could possibly be negative because they've either already had it or they have the vaccine. So it seems like that we should be advocating for a different metric or a relaxation of that metric, because it doesn't seem to be measuring the same thing it was 2 months ago.
I will say noted. I know those discussions have been happening amongst counties and CDPH for the past several weeks, especially as other types of testing modalities get up and running. People can, at this point, purchase tests that are home test kits, and how those are getting captured and credited for you know, testing volume that goes into that denominator is really questionable. And so we're I would say, especially in large counties, that's come up earlier because they're seeing that impact more directly in the numbers, and certainly that will impact us everywhere across the state if we're seeing volumes go down because people are getting tested and it's not getting reported through a traditional system, or because people are just getting tested less frequently. We are talking about the fact that that's going to continue to be a less useful measure. So I don't know that there's been any decision or what the next steps will be at the state, but we certainly will continue to have those conversations and advocate for either removing that metric or revising it so that we're able to capture as accurately as possible and have it do what it's intended to do, and showing what types of transmissibility we're seeing in the community.
Okay, thanks. And I guess the last thing I wanted to mention was, you know, with still about 10 cases a day, you know, that there's still a lot of contact tracing going on. And I just want to make sure you pass along to all of our folks that are doing that my appreciation, because I think, you know, they may be getting forgotten a little bit in the glory of the vaccine that everybody wants to hear, but that's still really important work that's going on. And I know they've been hard at it, and it's not an easy or fun job for a long time. So please pass along my gratitude.
Thank you. I will do that.
And Dan, you had something?
Yeah, I had a question, just wondering where we are status-wise in the 1A, 1B, since the Saturday and Sunday were I think mostly by age for us old folk. Does that mean we've gone through the at-risk groups in 1A and 1B and now are only on the 65 and above? Or do we still have some of the 1A and 1B at-risk people to do?
I'll take that, and I see you two nodding, Megan, so add anything I miss. We continue to filter in some 1A groups. So while we've moved solidly into the 1B tier 1, we still have 1As coming up, not a lot of them, but certainly still rolling them into appointments. 1B, we took a good chunk out of our 1B, and particularly on the age-based population, got a good number taken care of this weekend, but we still have in our registration system, just looking at it quickly yesterday, we still have quite a few people to get through, not only in the age-based tier over the age of 65, but definitely, and especially because the state has continued to refine and provide more clarity around how 1B is defined. I think we still have a good ways to go in the 1B. I will say too, though, that the state has announced that as of mid-March, I believe March 15th, we will, as a state, be moving into allowing for individuals who are under the age of 65 with certain underlying significant health issues to be eligible. That will open up, once again, a very potentially large portion of the population who's eligible. So it will take some time to start working through that group as well. But we are getting to the point where we've taken a big bite out of that group, and we're feeling comfortable that as the state moves forward in expanding eligibility, that we'll be able to start stepping into that expanded eligibility, and we're looking at strategies to be able to manage that going forward. So we're not done yet. We will continue. We're still making appointments and helping to get people filtered into the appropriate appointment, and we'll continue certainly to be able to fill those appointments over the next few weeks.
Right. My concern, as it has been all along, is that people who are at risk, like teachers and grocery store workers, that sort of group, that they ought to be getting through that list pretty quickly compared to those of us who are old but are not at much risk. And it sounds like that's pretty much being done, so that's great.
I did have one other question. So I've heard that that Toyabe, getting their vaccinations through the Indian Health Service, that they've made great progress, and that they've actually moved into vaccinating, family members and households of either employees or natives, non-natives who live with natives, which is great. And, I think we inquired before as to whether those numbers are counted in the state's reporting of the percentage of our population that's vaccinated. And I don't know that we ever got an answer to that, because that's,
Okay.
18% of our population.
I can answer that, and I appreciate you bringing that question up, because it does appear to be skewed in the state level reporting. So the vaccine that is being received directly at Toyabe from Indian Health Services is captured. If you look at federal statistics that show how many doses have been distributed, they do roll those Indian Health Services numbers in under the state level. So there is at some level that recognition as to how many vaccines are getting put out statewide. But in the state level accounting, really where we're pulling data is our state reporting systems. And because Indian Health Services is federal, our Toyabe doses are not counting in any of the numbers that are being reported for Inyo County as a whole. And I don't know that ever actually will reconcile, especially in Toyabe's case. They're getting an allocation that really covers their entire jurisdiction, which includes Inyo and Mono County. I just don't know that we'll get to a point where all of that really gets down to the individual county level. So where that ends up impacting us from a data perspective is obviously we're extremely thrilled that they're getting additional vaccine. We know there's extra vaccine in addition to what we're getting allocated, getting out to our community members. So the bottom line is that's all good. But at the state level, where we're continuing to put up new ways of measuring how vaccine is allocated and whether it's being allocated equitably, especially for populations that are disproportionately impacted, it doesn't reflect how many individuals who are American Indian who've received the vaccine in Inyo County. So when we look at the statewide demographics, that is skewed because largely that population is being served by Toyabe, and those numbers are not getting into our overall demographics.
Great. Do we have any idea how many doses have been given out?
I'm sorry, I don't have the most current accounting from them. I know they a couple of weeks ago they were able to do some larger clinics because they got an extra infusion of about 500 doses, and my understanding is that over week to week, they're getting about 100 on average. That may have gone up in recent weeks. And I'm sorry, I don't have the current.
Okay, that's okay. I sprung it on you. So, but I appreciate the answer. Thanks. Does anybody have any more questions or comments for the health team? Okay, I see.
I had one more. Sorry.
Okay.
Is there a chance that if we do get another, bonus week, that since they gave us Pfizer this time, that they would give us Moderna the next time, which would allow us to, I think would allow us to get the vaccine in, well, at least as far south as Lone Pine. I don't know if you could even go farther out or not.
I have a couple of points to make about that question. One is it is possible in reallocation to get at this point either the Pfizer or the Moderna. So it could be either one. If we end up getting another large allocation so that we can do a mass vaccination clinic, it could go either way. Pfizer is somewhat limiting, as we know, because of the ultra cold storage requirements. Moderna is somewhat limiting at this point because it can't be jostled very much. So they both have challenges and both are frozen vaccines. So they both present some challenges in really distributing out to outlying areas. And we are very hopeful as we learn more about, we do have another vaccine that we hope is getting close to being approved, potentially as a 1-dose vaccine from Johnson & Johnson and others that are out there, that as we move forward, we may have vaccine that's just a lot more transportable and I guess just less sensitive to being moved around. We are also, we continue to be concerned about some of the, even though they've been fairly mild, this weekend we're very thankful to be working out of a population center near a hospital. We did have to transport a couple of individuals, not because of an adverse vaccine reaction necessarily, but because of other health conditions that were happening. We did have to take a couple of people to the hospital. So that continues to be a concern. And I do, that cannot limit us forever. We do want to get out to some of our more outlying areas, but we are still at that point where we are concerned enough that we want to be close to a hospital as we're administering vaccine, especially if we're doing it to a large number of people. So we're working on our plans to be able to get out to outlying areas and are just not quite at the place where we can do that.
Yeah, it does seem like that across the country and in particular rural America or whatever, that is going to get highlighted. I mean, it really does set up at least some inequities, appearance of some inequities. And even if the Johnson & Johnson one does get approved, I mean, if you listen on the radio, it does, or on not the radio, in the 1950s. If you listen to the news, some of the reporting on it is that it's not quite as effective. It's a 1-dose, but it's not quite as effective. And even that, I do think, although I hope we get that and get it, able to start giving it out, there could be some perception that, oh yeah, we get it, but we don't get the good stuff. We get the other stuff. So I hope we can work through those issues. I'm not promoting those thoughts. I'm just recognizing that there could be some.
Also organized a rally in Oakley, California. That was where we saw the.
Jeff, maybe the doc could answer this. At first everybody was sort of just interested in, we need vaccines, and now we have vaccines. Now I'm getting some calls that say, well, yeah, but I don't like Pfizer. I want to wait for Moderna, or I want to wait for Johnson & Johnson. So I actually made some calls to some pharmacists, and the advice that they gave, which may or may not be what you say, Doc, but the advice was, if you want a vaccine, take a vaccine. Don't wait for something that, a Johnson & Johnson or a Moderna, because you don't like, you read something. We all Google stuff, and we all, I can't understand half of what I read. And if you do read it, you get like 180-degree arguments about why one vaccine might be better. So Doc, maybe you could answer that, and I think, or just speak to it.
Okay, what we have currently are the messenger RNA vaccines, Pfizer and Moderna, and they're pretty much equivalent. Efficacy and safety profile are practically the same. Now, in terms of severe reactions, we see probably a 5% increase over flu vaccine reactions, but eventually we may have so many vaccines available, such as the single dose Johnson & Johnson, that has an 80%, probably close to 85% efficacy against severe disease and 70% efficacy with mild to moderate disease. So that's a good vaccine. If we had that kind of efficacy with flu vaccines every year, we'd really be happy. So these are all good vaccines, and I would take any one that's available, just like the pharmacist said. But there may be a day when we have so much vaccine, you could take a pick, I guess. I don't know. Right now, I would get what you can.
Thank you.
Okay, we have a member of the public with a hand raised. If you could promote Kim Mitchell.
Hi, can y'all hear me?
Sure can. Go ahead, Kim.
Hi, thanks for all the work you guys did this weekend and have been doing for the last year. I got to help a neighbor sign up on the My Turn this weekend and had a little feedback that I was hoping maybe you guys could funnel up, which is that she was quite a bit older and it took her a long time to work through it. And by the time she worked through it, it had timed out and she was quite discouraged. So I sat down and I just did it for her, which was no trouble. But I wondered if the feedback to them might be to extend for older people that timeout function.
Thank you, Kim. I went through it and got timed out on the last question and had to start over again.
Yeah.
And as an older person, yes, lengthen that time.
Thanks
That
again, guys.
Oh, go ahead. I was just going to say that kind of concrete feedback is very easy to feed up and really, really helpful. So thank you for bringing that forward.
All right, and thanks, Kim, for helping out your Big Pine neighbors. That's really great. Okay, we have a hand raised with Deborah Morales.
Hi, everyone. This is Deborah Morales. I wanted to, again, I got to participate in this week's vaccination clinic, and outstanding job. It was seamless. People were happy, hopeful, smiles on people. It was nice to see my neighbors again. And so I just really wanted to extend my congratulations to your crew. It was just really a great day in our community. I do have a question though. If this was covered earlier, I'm sorry, I had to step away for a minute. What outreach is being done specifically to the Latino community? We know that COVID-19 has disproportionately impacted the Latino community, both locally and nationwide. And sometimes, I know that some of them are getting vaccinated because of the nature of their jobs and whatnot. But what is being done more to reach out to them besides, I've seen a couple translated Facebook announcements and that kind of thing, but are there other additional efforts being made to that community?
Great question, Deborah. Thanks. Does somebody have an answer for that?
Yes, I'll jump in, and I also appreciate that question. A couple of things that we're doing right now, as you said, ensuring that we have translated information, but also looking for opportunities to reach out in other non-traditional ways to be able to reach some of the communities that don't necessarily see advertisements in newspapers or listen to the same to local radio stations, for example, where we may be able to reach some of these other community members, and especially where we want to focus on getting Spanish language information out. So a couple of things that we're doing right now are, one, we have and this gives me an opportunity to also give some very specific kudos to our new COVID program manager. Her name is Genoa Manises, and she works mostly remotely, but was on site and really, really took the heavy lifting of all of the planning and management of the vaccine clinic this last weekend on site. And so I just want to give her props for all of the work she did to get the mass vaccination clinic done. She also has some real specific experience in marketing and is working on an improved communications plan, along with another temporary employee that we have on staff who's a master's of public health and candidate, and is working on additional outreach and advertising and information sharing specifically amongst our Spanish speaking community. So we're continuing to build out our communications plan and expand it so that we can get out to some of those community members, and also identifying other agencies to help us get that word out. So we've worked, traditionally with agencies like IMACA and through the school districts to help reach some of our populations that we don't reach through traditional media, but certainly are open to and interested in opening up and expanding our communication throughout the community.
Okay, thanks. And thanks, Deb, for the question. So with that, I think we will move on to Leslie Chapman. Do you have an update for us?
Good morning, everyone. The updates that I have on the grants are going to be covered in agenda item number 25. So rather than repeat myself, I'll just ask everyone to tune in then. The only thing I really want to say is just, like everyone else, thank you guys. You're such a great team. I feel really proud to be working with you and really appreciate the work that you're doing. And you deserve every single compliment you got today. So thank you.
All right, great words, Leslie. Okay, with that, I think we will wrap up the COVID update. Thank you so much. And you guys tried to get rid of Marilyn, but she came back.